Deuk Spine Institute. We're streaming live. We're going to be treating a patient who has horrible back pain right below her fusion. She had a fusion by surgeons in Ohio, L3-4, L4-5, L5-S1. Now she has adjacent segment disease involving both SI joints, sacroiliac joints. It's where the tailbone connects to the hip bone. She has horrible pain. Most doctors will tell you to get a fusion, but they're wrong. A fusion is the wrong choice. Fusions don't work. They just cause more pain. Jordan, show us the SI joint. Folks, you can see the SI joint we're targeting. There's the bottom of the joint. There's the top of the joint. That's where the tailbone connects to your hip bone. All right? Let's show the audience how SI joints hurt so bad and what we can do to fix that.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. You can see from our animation that the way that pain develops in the sacroiliac joint is through trauma. Basically an injury to the capsule, which over time continues to injure over and over again, making the joint unstable and then creating inflammation within the joint, which is exactly what this patient has. We see a lot of patients with sacroiliac joint pain here at Deuk Spine. As a matter of fact, it is the probably the fourth most common cause of back pain, tying in with the facet joints, which we treated earlier on her. Shot. So we're going to fix the other SI joint. Now, while we're here, folks, take a gander. Look at the scenery. We've got screws and rods. We've got cages. Let's show the audience her fusion. Screws, rods, cages. Why are there two different types of cages, you may be asking yourself? The answer is because she's had more than one fusion. The original fusion put those little cages in at L4-5. Jordan, show us the 4-5 cage. And then, of course, she came back years later. Not too many years, just a few. She had another fusion above and below the old fusion. And then, what's that? A pacemaker lying down here in her buttock? No, folks. That is a spinal cord stimulator. This is all the rage right now, spinal cord stimulators. It is the highest profit procedure any doctor can do in medicine. You can make $10,000 profit per surgery putting one of those in. So you may ask yourself, does insurance cover it? Absolutely, because the companies that make those stimulators, they go to politicians, they cut deals, they line the pockets, they go to the insurance companies and they say, you have to pay for this, and they do. And the insurance companies will pay, and they'll pay quite a bit for that thing. And the profit margins are so big that the doctors can't help themselves but put them in every patient that will lay down and get one put in. We don't do them at Deuk Spine because it's not right. We have curative procedures. Spinal cord stimulators don't cure anything. All right, let's go ahead and do that right there. We're going to do the left SI joint. Any questions? Type them up. But you've seen now not only how a sacroiliac joint causes pain, but how we fix it here at Deuk Spine permanently, by the way. so that the pain goes away permanently. What's the point of having a treatment that isn't permanent, right? Epidural steroid injection, not permanent. Fusion, not permanent. No pain relief that's permanent. Shots, not permanent. RFA, not permanent. So it's time we created some treatments that are permanent for our patients. Move. Any questions?
Yes, we have a few questions. This first one is from Darren on Facebook.
Sure, Darren.
Asking, I believe this is from the Deuk laser disc repair, asking, does your procedure remove scoliosis pain?
Yes, our procedure removes scoliosis pain. You know why I say that? Because scoliosis doesn't cause pain. It's not scoliosis that's hurting you, my friend, Sean. It is the disc, the facet, the SI joint. That's all that causes pain. How do I know that? You know how many people have scoliosis out there that have zero pain? Millions. As a matter of fact, is that it there? Yes, sir. Every single adult over the age of 40 has scoliosis in their spine. Degenerative scoliosis, okay? Every single adult has degenerative scoliosis. And yet, very few people have symptoms. As a matter of fact, most have no pain. Only about 10% have pain. So what does that tell you? It tells you the vast majority of patients with scoliosis have no pain whatsoever. Shot? All right, we're almost done with this SI joint. We need to do a little bit more work, and we'll be done. Any other questions, Shot?
Yes, this next one is from Thomas on YouTube, asking if the sciatic nerve runs through the piriformis muscle when you perform the Deuk piriformis release, is the sciatic nerve severed as well then?
Yes, great question. So Thomas is asking a very insightful question. We're not doing piriformis release yet. We're going to do that next. But what Thomas is asking about is when you have a torn piriformis muscle, like this patient, and the sciatic nerve we know runs through the muscle or below it, between that piriformis and the obturators, and the patient has butt pain, but they also have sciatic symptoms. When you go to do your surgery and release the muscle, do you actually cut the sciatic nerve? The answer is no. Cutting the sciatic nerve would leave the patient with a leg that doesn't move. They would be paralyzed. We don't want that. Paralyzed is bad. All right, so it's malpractice if you cut the sciatic nerve. We don't want to do that. We're just going to cut the muscle and get the pressure off the nerve. That's it. Great question. We're done with the SI joint, and hopefully this patient's going to have a great result with her SI joint pain with our Deuk plasma rhizotomy. By the way, our procedure is patented. It's available here at Deuk Spine in Florida. Find out if you're a candidate. Click on the link and come visit us online for a free virtual consultation. And you can find out, number one, what's causing your symptoms, but also how to fix it. All right, Henry, let's go ahead and end the stream, and we'll be back with our piriformis release in the same patient.